They say that only eating meat damages the thyroid. That's a big claim. Let's see if the science supports that. Hi, I'm Dr. Eric Westman, and welcome to my channel where I review and debunk nutritional misinformation online. In this video by an influencer who is an osteopath but says he doesn't practice medicine anymore so that he can get information out, we're going to hear about his take on whether the carnivore diet, other people think this too, causes problems, and especially thyroid problems. And the main theme in this video will be compared to what? So a normal range of normal means those who are unhealthy and eat carbs, the typical American. Do you want to be in that normal, that range? So compared to what? And then what are we truly measuring is going to be the theme at the end of this. And be sure to stick to the end where I give my final thoughts.
There are so many different diets and foods that you can eat as a thyroid patient that it can be hard to figure out what you should actually do. One thing is for certain though, the food that you put into your body can exert either a positive or a negative influence on your thyroid. One of the diets that is often touted as a cure-all to just about every condition is the carnivore diet. Proponents of this diet suggest that eating like our ancestors did has the ability to put multiple diseases into remission, help with weight loss, and more. But is this really true? And is this the type of diet that you should consider using as a thyroid patient?
Well, I have to vouch for the idea that the carnivore diet can reverse lots of things. I've seen that. Metabolically, a carnivore diet is a subset of a keto, low-carb kind of diet, very similar metabolism there. So that's not just theoretical. It is true that those things happen, even though he may not have seen it. He is, again, considered the source of information. If he's not in a clinic seeing people come and go, and the things change. In my clinic, the first thing that happened was people would be coming in saying, you know, I'm tired of this keto thing and it's too expensive. And I'm starting to think, well, why is it expensive? What I teach isn't expensive. Well, that's because the internet keto sort of blossomed and all these different products and different biohacks and ideas of things to have. So being in a clinic has been very helpful for me to kind of keep my finger on the pulse of what people are doing and what works and what doesn't work, at least in the limitation of the people that I see. I know certain things can happen.
My response? No, at least not for everyone. Will there be situations in which it may make sense for you to go carnivore, or in which certain people will gain benefits by doing so? Of course, because everyone is unique and there is no such thing as a one-size-fits-all diet. But does this mean that carnivore should be the recommended base diet for all thyroid problems and all thyroid conditions? Definitely not.
Well, you know, think about why you have a thyroid problem. If you were diagnosed with high thyroid activity and you had an ablation of the thyroid, so now you have low thyroid because your thyroid hormone doesn't exist, then you would be on a thyroid replacement. Most people, though, are found to have low thyroid levels compared to the normal range. You might have symptoms being lethargic, thinning of the lateral third of your eyebrows, dry skin, constipation. These are all very non-specific sorts of symptoms. But thyroid is often diagnosed by a blood test that's out of the range of those who are normal, meaning the carb-eating Western population. So we're going to get into a theme here where, you know, how do you diagnose the thyroid? What's the cause? And do you feel well? Is the thyroid level really all we need to know that you have normal thyroid? No, I don't think that's enough.
If you are thinking about going carnivore and you have a thyroid problem, here are a few things to consider before doing so. Number one, carbohydrates are needed for optimal thyroid function.
Yeah, I don't agree, but I'm building on this theme of the carbohydrate-centric view of the world, like the Earth geocentric universe or solar system, and the fat-based view of the world to explain things like the heliocentric, or sun being the center of the universe. It just predicted things a little better. Actually, thyroid functions normally without carbohydrate in the diet, but this is a common myth that's out there.
I think most people listening to this are probably already familiar with the carnivore diet, but in case you aren't, here is a quick primer. The carnivore diet is a diet that primarily focuses on the intake of meat, but it also allows for some animal products such as eggs and butter. This diet is very high in protein and fat, but is severely lacking in carbohydrates. This is by design because the proponents of the ketogenic diet and the carnivore diet suggest that carbohydrates are primarily responsible for the diseases that plague mankind. According to them, diseases like cancer, diabetes, heart disease, stroke, and more all stem from increased carbohydrate intake in the average population.
I'll vouch for the bottom ones, not cancer yet, although very interesting research going on there. So the science that we've helped to assemble and other people have as well, even in randomized controlled trials, the highest clinical level of science, all of those other things really do get better on a carnivore and low carb keto type of diet.
While this is technically true, there's a little more to the story. The body doesn't necessarily have a need for carbohydrates to survive, but it appears to need carbohydrates to thrive.
So that it has a nice ring to it, doesn't it? You need it to live or survive, but not to thrive. Well, what's the evidence for that?
Very low carbohydrate diets, sustained over a long period of time, have been shown to cause negative effects on thyroid function. This is seen in studies such as this one. What researchers see is that as carbohydrate intake decreases, the conversion of active thyroid hormones decreases as well. This is reflected in thyroid lab tests as a decrease in T3 levels, an increase in T4 levels, and usually no change in the TSH.
One of my teachers some years ago taught me that we measure the blood because it's convenient. You can just take a needle, take typically the arm or even the capillary, the finger. It doesn't always tell you everything you need to know. Now, this is kind of an advanced level, yet pretty obvious thing, right? Doctors focus on the blood level, and here we're talking about the blood level being different and testosterone and all these things. Menstrual cycles can change with any sort of dietary change, which is another issue about talking about a particular type of diet. If it's different than before, you're going to have changes regardless of what diet it is. But so we can measure blood. It's convenient. It doesn't really always tell us what we want to know. So the blood level of thyroid does not tell us actually how it's working inside the cells. Let's listen.
If you aren't familiar with thyroid lab tests, allow me to explain what this means. The TSH is a measure of total thyroid function in the body. So at first glance, you might see that there is no change in the TSH with a reduction in carbohydrates and think that this is a good thing. But the problem with decreasing your carbohydrate intake doesn't come from the change in the TSH. It comes from the change in circulating thyroid hormones and their relation to one another. T4 thyroid hormone is considered an inactive thyroid hormone, which acts as a reservoir that your body can draw upon to create the most active thyroid hormone known as T3. The shift that is seen in thyroid hormones when the body is in a low carbohydrate state is to reduce the conversion of T4 into T3, thereby lowering the most active thyroid hormone. We see this same thyroid lab pattern in people who are chronically ill or in those who are under extreme stress. In other words, low carbohydrate diets cause changes in thyroid function which are not seen in healthy people.
Well, healthy people is defined by the lab tests of Americans who are what's the latest? 80% are not healthy. So this is the short way to say that is you're comparing your blood level to unhealthy Americans who eat carbs. Is that really what you want to do? No. With thyroid, you want to talk to somebody, see whether there are symptoms or not, rather than just look at the blood level.
The advocates of the carnivore diet are aware of this, but they will try to suggest that the changes in thyroid function are really an adaptive response and may confer some benefit on longevity. It's hard to know what exactly these changes mean, but there's no question that at least for some people, going carnivore may be enough to make their hypothyroid symptoms worse or push some people into full-blown hypothyroidism. This doesn't mean, by the way, that everyone who goes carnivore will have or experience problems.
I'd like to see a study or a case study on that. Often we can learn from individuals, someone's anecdote, some story. A credible anecdote might be your own experience. I've not seen anyone go into full-blown thyroid problem with any diet that I know of, but I'd like to learn more about that. The first thing I do is I would ask you how you feel. Do you have plenty of energy? Are you able to do what you want to do? Then you check the blood level. And in the old days, even before the blood level was checked, yes, you would talk to people, and you would also measure the body temperature, kind of like checking for your ovulation, the time of the month. You can actually measure the body temperature first thing in the morning. There's a method on how to do it. And you can see if your temperature is in the normal range compared to unhealthy carb-eating Americans. But if your blood levels are normal, but your body temperature is, say, 96, no one's really 98.6. That's not really the right body temperature. It's not normal, even though it says it on your thermometer probably. Living in the 98, 97s in Fahrenheit is where most people are. If you're in the 96, you have florid symptoms of low thyroid, or your thyroid level is normal, I would still alter or change the thyroid hormone. That's kind of an advanced practice pattern of obesity medicine specialists, where we need to make sure the thyroid level is optimized. You need thyroid function, not blood level, because it has such a big effect on weight and weight gain.
Number 2, decreased carbohydrate intake increases sex hormone binding globulin and decreases the activity of sex hormones. We know this from both real-world examples of people who have gone carnivore and shared their labs, and from research studies.
So lab tests from those who were eating carbohydrates, is that really what the comparison you want?
They all show the same thing. As carbohydrate intake declines, sex hormone binding globulin levels increase and free sex hormone levels decrease. For those who are unfamiliar with sex hormone binding globulin, let me share some simple details.
So I'm thinking of some cases recently where in the couple dynamic, the last thing that the man would want is to have more testosterone. And while so I know that may seem bizarre, but so we're talking about real people and what you're trying to accomplish in life. And these are not necessarily appropriate things to follow, because you're comparing yourself to the way you were before, a carb eater probably, and to carb eaters, which is the normal range that you see on the lab test. So a ketone level being high will be flagged as abnormal compared to those who eat carbohydrates, because those who eat carbohydrates don't have ketone levels that are high. It's not abnormal if you're on a keto diet.
Sex hormone binding globulin, referred to as SHBG, controls how much sex hormones your body has available for use. The higher your SHBG is, the less active your sex hormones will be. It's that simple. For men, this is seen as a decline in free testosterone levels, and for women, it's seen as a decline in free estradiol levels. The impact on both hormones is the same for both genders. It's just that the physiologic impact differs because each sex hormone is more important or less important to each of the genders.
And I have to say, this is a problem of most practitioners today, that they focus on the blood because it's so convenient to measure, and we've set up guidelines and guardrails for blood levels of things. We have to get beyond that. We have to talk to people and ask them how they're feeling. And the mere fact that there's less or more of a hormone, it doesn't tell us really about the function of the hormone.
But why does this matter for thyroid patients? Aside from the fact that optimal sex hormone function is ideal if you want to live a long and healthy life, there is also a bi-directional relationship between your sex hormones and thyroid function. Thyroid hormones impact sex hormones like estrogen and testosterone. Men will see a decline in libido, erectile dysfunction, low testosterone, and decreased vitality if they also have low thyroid function. We also have some real-world examples of people who have been on carnivore and who have shared their lab work. Dr. Paul Saladino, MD, is one of these. He has gone on record sharing his lab tests while on carnivore, including thyroid function and sex hormone function, and after the introduction of certain carbohydrates like honey and fruit. And what he shares tracks exactly with the research I just mentioned above. While on the carnivore diet, he experienced a sky-high SHBG, a low free testosterone level, a high normal TSH level, and a low T3. After adding fruits and honey to his diet at about 200 grams per day, he saw a very large drop in his SHBG level, a rise in his free testosterone level, a decrease in his TSH level, and a rise in his free T3 level.
So are you surprised? So if you drop foods, measure the blood, you worry about it, if you add back the carbs, the levels will go back to where they were. It doesn't mean that it's better. And I don't really, again, follow influencers who have a kind of almost flapping in the wind effect of checking a blood and level and then getting worried about it. We need to take more systematic view of how things can change, and the blood is just a simple, inconvenient place to check things. I mean, when you step back, if you're going to claim that there's low thyroid or the thyroid is damaged, where are the thyroid biopsies here? So meaning you take the tissue, you look at under a microscope, and then you say, oh, see, the carnivore diet causes bad thyroid function under the micro. No, we're not doing that here in this video. We're talking about a blood level, and then the doctor here is making concern and fear mongering about how, my goodness, and you don't even eat fruit. I mean, no, this is not what we're talking about. We're talking about metabolism. I'm not so concerned about what's on the plate. I want to know what the metabolic changes are.
These changes in lab tests were also associated with more energy and a higher basal body temperature. What's even more interesting is that all of these changes occurred without impacting his fasting insulin level, which remained undetectable both before and after the introduction of carbohydrates. Why is this significant? Because at least anecdotally, it shows that carbohydrates are not only essential for thyroid function and sex hormone function, but also that including carbohydrates into your diet doesn't always or automatically have to impact your insulin level in a negative way.
So this is an interesting logical flaw, because you were one way while you were eating carbs, and then you ate a different way and the blood levels looked different, and meaning worse. That you went back to the way you were eating and things looked fine, back to the normal way that they were, and they didn't affect insulin levels because you didn't have an insulin problem to begin with, probably. And then he says anecdotally, when, it was that one person's experience. This is where research is needed, or you do your own N of one study, but you're not just checking your blood levels, you're checking how you feel. And fascinating how this is a kind of mechanism of fear about changing your diet to something that you might think, well, it's at least not socially acceptable because the blood level is not where it used to be. And then you add back carbs, and the blood level is back to where it was, and now we're fine. Well, I don't buy that logic. Let me know your thoughts in the comments below.
The third reason to avoid carnivore diet if you have a thyroid problem is because there are better ways to lose weight. I think one of the main reasons that people are drawn to the carnivore diet is because, number one, it's relatively simple to understand, and number two, there's a promise of rapid weight gain at the end. This is particularly appealing to thyroid patients who often struggle to lose weight. But is there anything special about the carnivore diet that can't be obtained with the use of other diets? No. Some people try to suggest that the carnivore diet is superior to other weight loss diets.
So he led with, there are better ways to lose weight. And then he went to, there's no advantage to a carnivore diet. Well, that doesn't mean there are better ways. This is fascinating, because when I was doing our research on low carb diets, I didn't just say low fat diets don't work. I said low carb diets work and low fat diets work, but low carb diets work better. And study after study after study, finally there was an infographic that showed, something like 20-0, the low carb beat out low fat. So for someone to say with science that a diet is better than carnivore, you really need a randomized trial to show that it's better. Just for someone to say that a vegan diet is best and better than carnivore or keto, you need to have a study that shows that. I mean, what we're talking about here, he's talking about there are other ways that can work, and because carnivore is so crazy, that therefore these other things are better to do. I'm not so, how should I say, I'm not so sure anymore that something that's scientifically sound in terms of metabolism, like a low carb, keto, and carnivore kind of eating, I'm not so sure that these are necessarily bad things and that there's always something better to do. The recent study by Lucia Aronica of the Stanford group that showed the extreme dieters in this randomized trial who did low carb, low fat versus low fat, high carb, but no junk foods. This is the Diet Fits trial. They had similar metabolic effects. So that the science is saying that you can do a low carb diet and get insulin resistance reversal. You can do a low fat diet and get insulin resistance reversal. And the question in this study was one better than another, although it looked like low carb was better on that insulin resistance pathway, but it's just the first kind of study. But so to be so sure that there are other better ways, I want to know the science for that. I don't see it. Do you?
Because it results in more rapid weight loss. And while this may appear true, it's actually somewhat misleading. The weight loss associated with low carbohydrate diets will always appear more rapidly, at least in the beginning. But this is because these diets impact fluid levels as well as bowel movements. An increase in bowel movements and changes to the kidneys from changes to insulin result in the excretion of more water from the body. Because of this, it makes it look like you lose weight more rapidly than you really are. But when you break down the fat loss associated with the carnivore diet and other low-carb diets, and account for this loss in fluid, you see that there are no differences in fat loss between the carnivore diet, keto diet, and other weight loss diets.
Well, and so being in a clinic, having focus on weight and diabetes, metabolic reversal would be really helpful for Dr. Childs and for any influencer who's trying to compare how diets work to each other on limited randomized trial evidence. And so what I find is that, yes, you might get a little more water loss at first, but over a year, you can lose as much on a carnivore diet as a keto diet. And I don't really prescribe many other types of diets. I send them people to other practitioners in my area for that kind of expertise. But so here we're really on thin ice when we're looking at comparability and then also talking about the detail of, it's just water weight. No, over time, you can help someone lose 100, 200 pounds. It's fat weight. And yet I never really understood the, almost like, that's so popular, we have to bring it down somehow. Why dispute it without data? I don't understand that.
It just appears to be more effective because weight loss on the scale is more pronounced when you first start the diet. The reality is that you can absolutely lose weight at the same rate as the carnivore diet when using a healthy whole food diet.
So again, if it's as good, it's not better. This is not logic.
And these healthy whole food diets that include sources of carbohydrates from fruits and vegetables do not come with all the same baggage that the carnivore diet does.
Where was the baggage? I don't see it. The difference in blood levels from those who eat carbs or when you ate carbs before, blood is simple to check. And sure, if the potassium level was 2.0, which is very, very low, I would be alarmed. And if there are some blood levels that I take very seriously to be in a certain range. But the ones we're talking about here, the hormonal effects, the ketones, even the iron-based metabolism and glucose metabolism now, it may not necessarily fit into that normal range of unhealthy Americans. It's what's most commonly seen, but it's not necessarily normal.
Reason number 4 to avoid the carnivore diet, it may cause issues with your sleep.
So if I was going to say to you, take this pill, it may work. Would you take it? So I'm not, just to have the language here, it may cause sleep disturbances. This can't be a very big one.
The final nail in the coffin for the carnivore diet is that it may negatively impact your sleep. This particular issue is well known among the carnivore community and is commonly referred to as carnivore insomnia or keto insomnia. Its exact cause is not known, but it definitely has something to do with carbohydrate intake.
So I'm not sure. Do you know carb eaters who have insomnia? Do you know? Of course. So this is a great comparative study that needs to be done to see if there is more insomnia for those who don't eat carbs, for those who do eat carbs, or even in your own experience. And sometimes there are transition symptoms, meaning that your body is adapting to a different metabolism. We call it keto adaptation. In that early phase, it could be headaches, it could be fatigue. Occasionally, people have what's called a keto flu. It's not very common, but they feel like they're in bed with muscle aches as your body kind of gets rid of the carbohydrate metabolism. And then after you keto adapt, you feel fine, probably even better most of the time. The sleep, bowel movements, exercise ability during this keto adaptation phase may not be optimal, may not be normal, because things are transitioning. There was a great metaphor recently where, let's say you took people who are totally sedentary and started an exercise program where they had to run a mile a day, and then you asked them at 2 weeks how they feel. Well, they feel sore and they feel terrible because they're starting an exercise program. Well, like, duh, so there's an adaptation to exercise. There's adaptation to keto as well. And interesting to hear the language here, the final nail in the coffin. I don't think there's a coffin here yet.
With all this in mind, are there situations in which it may make sense for someone with a thyroid problem to go carnivore? And the answer is absolutely. The situations that I'm referring to are those of autoimmune thyroid disease and in thyroid patients who have a combination of a thyroid problem plus diabetes. Let's talk about the autoimmune diseases first. The reason that I think it may make sense for thyroid patients who have an autoimmune thyroid disease to use carnivore is simply because there are so few treatments for these patients out there.
Well, hang on. Actually, now Dr. Childs is going farther than I would to say that you ought to use this for autoimmune thyroid problems. I don't know of any study about this. Sure, a few anecdotes out there here and there, but show me 10 case studies, 10 anecdotes. That's called a case series. I haven't seen it. It's very interesting that he's kind of saying that it would be fine and effective for autoimmune thyroid problems like Hashimoto's. I want to see the data for this. If he knows about it, I wouldn't go as far as what he's advocating here.
I'm not even saying carnivore is the best diet to use if you have an autoimmune thyroid disease like Graves' disease or Hashimoto's. But it is a really simple and easy diet for the average person to wrap their head around.
So the logic here was, because there isn't anything else to do, you might as well try a carnivore diet for this autoimmune problem. Well, that would open it up for a range of other autoimmune problems, which, yes, there's a strong internet signal about. Well, what I see percolating up is there's a case series of 10 people published with resolution of ulcerative colitis and Crohn's disease. These are kind of classic autoimmune issues. And then, yeah, there's some influencers online, but I'd like to see these formalized into studies and published before I, say to my academic colleagues that there's some, signal here.
Having said all of this, even if you have a thyroid problem and you were to go carnivore, I don't see any evidence to suggest that you should be using it long term. The best way to use a diet such as this is to use it temporarily until you have gotten the problem you are trying to tackle under control.
And again, this is kind of, well, you don't want to be doing that crazy thing, even though it fixed your this, that, and the other thing, because we just don't know about how it'll affect you. Well, it fixed your this, that, and the other thing. Reminds me of the slide years ago based on the Atkins diet. There was a slide that we show where a doctor is admonishing the patient, I know that Atkins diet cured your diabetes and you lost 100 pounds and you're feeling great and you're running 2 miles a day, but careful, because that diet's going to kill you, that Atkins diet. And through the years I would change Atkins and say LCHF or low carb or now carnivore, because the logic is just, it's interesting, isn't it? I mean, you did all of this to fix all of these things, but then you should stop it. And, it took, I remember thinking that way. We did a study for 6 months and I would present it and people would say, well, what happens at 7 months? And I would say, well, I don't know. We stopped it at 6 months and they're all gone, those and patients, research subjects. And then we do a study for a year. And then well, what happened at a year and a day? And well, but everything looked fine at a year. So there's always going to be this, well, what about if what you've done has gotten you off, the cliff, so to speak, and you don't want to go back to there. I'm thinking that this is a pretty good path to be on, even if it's not socially acceptable or there's not a whole lot of published science about it yet. There's actually a lot of published science based on the keto metabolism, which is the basis of the carnivore metabolism, very similar to that. So again, I don't understand the logic, Dr. Childs. Well, I like going over this video because there are a lot of common fallacies or almost illogical ways of thinking that just keep people away from something, I think, just because they don't know about it, or the false assumption that because it's different, it must be bad. I see that a lot in the medical mainstream, or that you're not using a medication. How could a diet possibly be better than medication? And let me tell you, the dietary change is better than 10 medications. We take away, we call it deprescribing, take away medicines all the time using these dietary approaches. So not too happy with this kind of analysis of the carnivore diet and thyroid issues, but let me know your results down below in the comments. I would appreciate that. If you like, please like, subscribe, ring the notification bell, send this video to a friend or a relative. Be sure to look for new content on Wednesdays and Fridays. If you enjoyed this video, consider joining our YouTube membership for early access and exclusive live Q&As with me. Just click the join button below or support us with a PayPal in the description.